If you are thinking of a bank that takes care of customers' needs by providing quality services with flexibility, reliability, and innovation, think Trust Bank Limited. With Trust Bank Limited mobile banking, you enjoy services such as balance inquiry, mini statement, funds transfer between accounts, exchange rates, mobile airtime top-up, stop ATM card, checkbook request, and PIN change. Our real-time gross settlement allows the customer to instruct the bank to transfer funds from their account to another account at another bank. Our expertise and experience in international banking is both legendary and the envy of the market. Retail banking, one bank, different amazing packages. Whether you are interested in savings account, current account, time or fixed deposit account, lending or overdraft, our team of dedicated staff is always ready and willing to help you out with your transactions as you wish. Corporate banking. Trust Bank Limited offer the most convenient services for deposit accounts, credit facilities, trade finance, bond and guarantee, and foreign currency account. With e-banking, you can make electronic bill payments and online banking and enjoy 24-hour access to your cash with our ATM. With the largest network of branches and agents, we give you the convenience to receive funds as you please. Trust Bank Limited, proudly Gambian.
fay lempo warugal la ci képp koo xam ne doomi réew mi nga ak ñu fi dëkk bu fekkee ne ci at mi sa koom-koom weesu na $2,400 dalasi mbete weer bu nekk di nga am lu tollu ci $2,000 dalasi lempo si la nguur gi di sukkandeku ngir liggéey yokkute réew mi GRA mooy banxaas bu nguuri Gambia sas ngir mu fayeku lépp luy lempo ci biir réew mi ba tax na GRA di yëgal faykati lempo yi ne warugal la pour ñu fay lu ñu naan withholding tax on contract payment maanaam bépp contract bu waay joxe te ci biir réew mi lañu toog kon xaalis ci contract bi ngeen nangotoo war nga cee wàññi ci xayma téeméer bu nekk fukka bu fekkee ne contracto bi dëkkut ci biir réew mi bu boobaa di nga war a wàññi téeméer bu nekk fukka ak juróom lii mooy lempo bu ñu naan withholding tax on contract payment lii mooy lempo bi nga xam ne yow mi joxe contract warugal la nga wëlbatiku dem fay ko ci maakaani GRA tax office bu la gën a jege mbete ci banque yi GRA jagleel pour fay lempo war ngaa jébal lempo bi si diiri fukki fan ak juróom gannaaw bi nga wàññee ci xaalis si contract bi amul benn contracto bu ñu teggil fay lempo bi xanaa mu fekk ne nguuri Gambia ñoo ko jégale boole si projet yi nga xam ne mbootaay ndimbali ñoo koy dépense GRA di fayeku lempo ngir yokk.
For the first time in the history of the Gambia, Gambia Printing Publishing Corporation proudly introduces the Biliomatic exercise book printing machine. The machine has the capacity to print more than 20,000 books per hour. Yes, 20,000 books per hour. It also prints magazines, newspapers, calendars, flyers, normal books, and all kinds of printed documents, plus items at affordable prices. With the Biliomatic printing machine, GPPC can now render high quality and non-size restricted printing service supply across the sub-region. Rush now and partner with GPPC for all your public and private printing service needs. Print with us today and you'd be offered highly professional, reliable and efficient service delivery by our team of experts. The Gambia Printing and Publishing Corporation is here to meet all demands and is reliable at all times. For more info, contact us on 437-4493 or 437-4402. GPPC is Gambian and it's yours.
In communication, connectivity is everything. We ensure that the links never sleep. Quantities and qualities all in our data service, providing efficient, reliable voice and data service. We believe if you're not up to speed, then you're going backwards. Communications have to flow as fast as the speed of light. Whatever business you're in, having someone who understands your needs is critical. That is why we just don't offer you technology, we offer you solutions.
This is Kerr Fatou. Fatou. Oli.
Hello and welcome to this special program here on Kerr Fatou. Today, it's Thursday, and of course, every Thursday we come to talk about issues that are happening in the country. And Esa today is not available, so I will be here on the show with my guests. I will have Markieu Janneh Kaira. Markieu is the Executive Director of Medicine Control Agency. And later on, I will be joined by Modou, Njai, Director of Health Services, Ministry of Health. As you all know, the Gambia is facing some issues right now. About a month ago, the Ministry of Health issued a statement regarding some medication that was causing issues for babies. Reportedly, about 60 plus children died as a result of that. And yesterday, the WHO did issue an alert saying these deaths that was caused in the Gambia is as a result of a medication that was brought in from China. Now, to clarify all of these things, I have the Executive Director of the Medicine Control Agency. Now, the Medicine Control Agency, we'll get to know what their role is. What do they do when it comes to medications? The Ministry of Health as well. I'll get Modou Njai to tell us what they do as well. Markieu, welcome to Kerr Fatou.
Thank you very much, Fatou. Thank you.
Now, Markieu, let's talk about the agency first. Tell us, what is the role of the agency? What does the agency do?
Well, the mandate of the Medicines Control Agency is to regulate all medicines and related products with regards to their quality, safety, and efficacy. So that's what the mandate is, that we control all issues and all matters relating to the quality of the product, the safety and the efficacy. That is the mandate of the Medicines Control Agency under the Medicines and Related Products Act of 2014. Yeah,
now,
and then
go ahead.
Okay.
Go ahead.
Yeah, that the agency was established then after the mandate from the Act, which we're calling the Medicines Control Agency, and we started operations really, I think, in 2017. That's when we started with the recruitment and putting the structures and the systems in place.
Now, since this establishment, what else does the medicine also issue license for pharmacies to operate in the country? Is that also part of your mandate?
No, the issuance of licenses of premise is under the mandate of the Pharmacy Council of the Gambia. What the Medicines Control Agency does is, the Pharmacy Council is responsible for the professional practice and also the licensing of the retail outlets. The Medicines Control Agency's responsibility is for licensing of the manufacturers, maybe it's locally or internationally, or the importers, bringing the medicines into the country. So the retail license of retail outlet is actually under the mandate of the Pharmacy Council of the Gambia.
the country? Because that, I think that is very key in your operations, right?
Sorry, I don't know. The internet. I wasn't hearing what you said.
I was asking, what are the processes that it takes for somebody to be able to bring medications into the country?
You need to be a licensed importer, and for that you need to at least engage the services of a registered pharmacist here in the Gambia. So it includes having the right qualification, the right papers, and the right setup, and then the application is looked at, vetted, then approved for you to be a licensed importer. It's different. If you want to be a licensed wholesaler, it's a different license. And a retailer also is a different license. And those other two are actually under the mandate, as I said, of the Pharmacy Council of the Gambia. So
the argument that has always come up is there's a lot of the people that have license, they either rent out their license to other people, because anybody who has a license is able to import medicine into the country, right?
Yes, if you have a license, you can import.
So what happens in the event I have a license and then I rent it out to another professional, and they can automatically they are entitled to import medication into the country?
I'm not quite sure the word renting. I mean, I don't think licenses are rented. Licenses are not rented. I mean, as I said, if you want to engage into a business of importing medication, you need to engage the services of a license, of a registered pharmacist. So, because it's technical, you need to have someone who has, the technical background that probably could advise you appropriately as to what the regulatory requirements are according to the Medicines and Related Products Act to be able to, perform and operate. There are also what we call the drug outlets. These are for maybe the pharmacies or the importers. But as a wholesaler or retailer, still, you still need to engage the technical person. If it's the pharmacy, then you need a registered pharmacist. If it's a drug outlet, that's also a retail outlet, then you need to engage the services of either a nurse midwife with so much experience, post-qualification experience, or a pharmacy technician or a dress-up dispenser. These are all options, and these are all what is actually in existence. It is not only, I mean, I know we use the word just pharmacies as everyone, but there are different categories that sell medicines. Those are the pharmacies, the drug outlets, and for the over-the-counter medicines, we call them either supermarkets and so on. But all these premises are actually given license by the Pharmacy Council of the Gambia, and based on the category, you need to have a certain qualification to be able to operate that and to be given that license.
And so are those processes really followed? Does the medical agency follow all of these processes to make sure whoever is selling? Because sometimes you see people just go to Europe and come back and bring all these medications into the country. Yes, there might be good medications, but some of them might be expired. You see over-the-counter medications everywhere. How does the agency supervise these medications and other consignment that comes into the country? What are the supervisory methods that you put in place to make sure we are not consuming expired or bad medication?
Right. This is with regards to the agency has guidelines. I mean, we do have a website where all the regulatory functions that we are performing, we have guidelines for them to give guidance to the population as to what they need to do if they want to fulfill the legal requirements for that certain process. So for that one is the issue of inspection. Now, the Medicines Control Agency have an inspectorate. And if you're a legal importer, I'll have to explain two processes, whether you're a legal importer and if you're an illegal importer. For a legal importer, there are guidelines and there are SOPs. As a legal importer, you need to make sure that you submit the application for import clearance permit, which you submit into the agency. You attach the medicines that you want to bring in, and then the inspectorate When it comes into the country, you're supposed to alert the Medicines Control Agency. They spend the inspectorate. This is the pharmaceutical importers. This is what we do with them. You go, you inspect to see whether what they have said they're importing is what is actually coming into the country. And then, so I have another line coming in. So if, for example, illegal, but then there are different ports of entries. So when it comes to, sometimes we have issues at the border. Of course, we don't have inspectorate covering the whole country, but it is widely known, and we collaborate with the customs and the port, that they should not let in any importer or any illegal importer that is bringing medicines without coming through the agency and having the seal and approval of the agency. But again, we have sometimes problems with the, with the borders, or some people, they bring it in sometimes in containers, as I said, sometimes they bring it in suitcases. So it is really, that is very difficult to control, to be honest. But as long as we have the cooperation of the public, we have the cooperation of the other stakeholders, definitely, as soon as we are alerted, we do make sure we send inspectors, and we try to, make sure that at least non-expired and non-quality medicines are coming into the country. But again, it's an issue, and we definitely, are in the process of building the capacity and building at least the strength of the inspectorate.
Now, to be specific, a month.
Sorry, I can't hear you, Fatou.
Can you hear me properly
now?
You. Can you hear me? Can you hear me?
Sorry, I can't hear you anymore.
I think because, can you leave and coming back? Because it seems like
I can't hear you anymore.
Can you leave and come back and come back?
Oh, I don't know why, but I can't hear you.
It's because someone called you. I think it's because somebody called you, so that.
I'm really, sorry, I can't hear you. I can't hear you. I can't hear you anymore. Oh, wow. I can't hear you.
Oh, it seems like she can't hear me. Sira, can you take her off, and then can you leave and come back?
I can't hear you.
Can you hear me? No, you cannot. Sira, can you take her off? Sorry about that. We had to lose connection because there were some issues with the broadcast at that point. Markieu, welcome back to the show.
Thank you, Fatou.
So we were talking
about. Yes,
I can hear you.
Yes,
we were talking about the earlier on. We were talking about the agency, the role it plays, and what you guys do when it comes to the processes you take to bring medication into the country. Now, I want us to talk, to be specific now, to talk about the incident that is happening right now. The Ministry of Health issued a statement about about a month or so ago, about medication, a syrup, cough syrup that was causing some kidney issues for babies, and they recalled it from the market. And apparently yesterday, the WHO issued an alert saying the cause of those deaths, the 66 babies that died, was as a result of that medication that was recalled. Now, tell us what really happened. What did the agency know about this? Did the agency know prior to the cause of the deaths, or it just happened when the ministry detected it?
Thank you, Fatou, for your question. As you said, the WHO alert came out yesterday as a result of the information that we gave to the WHO. We are working with WHO strongly. They're giving us some support. They're working with the Ministry of Health. So these information are actually, given to them for the alert. With regards to what we have done, I mean, the cases, as you heard, under the Ministry of Health, that's when it started, the suspecting cases. I mean, it's still, as we said, the cases is still ongoing. Investigations are still ongoing. But since we have strong suspicions, and because of some of these medications have been found to be contaminated, but that's through the suspicion. This is an issue that, initially, there are different other factors, because some bacteria, bacterial infection can cause acute kidney injury. So getting these investigations, and they were doing surveillance, then they had some multiple factors. Out of the factors, this medication became an issue, and then they started pinpointing to the most common syrups that the children at this age are taking, which is, paracetamol is one of them. You have also promethazine, which is a medication that is used for children that are vomiting, because most of the children apparently that went to the hospitals were because they were experiencing some vomiting and some fever. So these are medications, that the parents, the parents reported that is because their child were suffering from vomiting and fever, which is why they went to buy this medication. So, you cannot just, there was a reason why they went to the hospital, or was a reason why they took this medication. And through the investigations and with the, the hospital and the, the clinicians, then these are the factors, some of the factors that came out. And so when it came out, then we were then as Medicines Control Agency, we were, then mandated to at least collect samples of these suspected medications, which we did, and then we sent tests. But even before we received any results, we went to take action and put a quarantine and a recall and suspension on these suspected products. Initially, it was paracetamol. Then we said, well, they're not only taking paracetamol, they're taking other things for their vomiting and so on. So that's when we had the categories of including, the promethazine and the cough syrups, and even more than that. And these things were sampled, and then out of the lots that were sent for sampling, some of these came to be, contaminated. And again, this contamination is, something that can cause or will cause, because it's harmful, it causes also acute kidney injury. Investigations are ongoing. Of course, they are not conclusive, they're not complete, and we are continuing to take samples to be sending them, for investigations. But as of now, we have done the quarantine of these particular products. They have been recalled from the system. All healthcare workers, all pharmaceutical outlets have been instructed they should, not sell these paracetamol cough syrups or promethazine syrups, even though we have gone to all the ones that we've been, that have been indicated. The inspectors have gone around to collect them from the importers, the wholesalers. And as we speak, there is an exercise going on, a household recall, where we're not only stopping at the retailers, the drug outlets, we're also now going house to house in the communities with the Red Cross volunteers and the staff and officials of the Ministry of Health to actually withdraw whatever syrups that they have. Because if you take them from the outlets, but mothers had already, paracetamol, most mothers keep them to say, or promethazine, in case my child is sick, or this was left over. So we want to prevent any more harm from that. So we're actually doing a household recall to prevent, mothers using any of these syrups. Some of them, of course, are fine, but since the investigations are ongoing, we want to clear the system before we tell people that you can go ahead now. I mean, this will be the role of the agency. We're doing investigations, we're doing more tests, and as soon as we find we're comfortable and the samples are clear, we'll definitely tell the population that they can go ahead and start using them. But it is a very sad situation, and where the loss of lives is highly, it's devastating for the population at large, and really it is something that the Ministry of Health and the government of Gambia have seen it fit to really prioritize and strengthen the system, strengthen the regulatory agency, being a young agency, increase the capacity so that we can actually do all the functions. I know you had asked before what are the systems we put in place to ensure quality medicines. And I think I only talked about the importation and the inspection side. Yeah, one of the most critical functions of the Medicines Control Agency is actually providing marketing authorization or registering these products. And the registration of the products, it is a process where each medicine is submitted, the samples are submitted, and dossiers are done to review. I mean, the final stage is the testing, but at least you are ensured that the facility, the process they use to manufacture is in line with regulatory requirement. So these things are done, and at the moment we're doing it for priority medicines and medicines that are highly, they are the most, commonly found diseases. Like, we do it for the the analgesics, painkillers. All painkillers need to be registered with the Medicines Control Agency before it is used in any outlet. And inspectors go to find. If they find a sample that is not been, registered, then it is confiscated, and then you are given, you're liable and you're sanctioned. And this has been done for a category, various categories of medicines, as I said, that are most commonly used. That is analgesics, there's painkillers, anti-diabetics, antihypertensives, antibiotics. These are, mostly the ones, and anti-malarials that we have started with and we are registering and are very strict about it. Unfortunately, as I said, a young agency, there isn't the capacity to register all products in the market at once. If we are to do that, then the population with, access will also be a problem. But
then Markieu, that raises a lot of concerns, because if we are not able to do that, like, I know it's going to, it's better to be sure than to put out something that we don't know about, because as we are speaking right now, this particular syrup that came from India, the reports that we're getting is that the manufacturers right now, when this scandal came out, they have closed their pharmacies and right now, and they are not producing. The Indian government issued a statement saying it's a usual practice that importing countries test these imported products on quality parameters, satisfy itself on the quality of the products before importing country decides to release such products. Now, does the Gambia do all of these things before we bring in any medicines into the country, especially medicine that come in bulk?
Yeah, as I said, we are doing that. But again, the capacity is not there to do for every single product. I mean, it is, as you know, I mean, it is an unfortunate circumstance. And countries with even higher, bigger capacity, you hear these happening. I mean, these are unfortunate circumstances that sometimes they do fall through the system. It is very unfortunate, and the higher the capacity and the more capacity you build, you'll be able to at least reduce the incidence of these things happening. But you find it happening in regulatory authorities. Countries with regulators have been in existence for 50 years. As I said, I mean, so some allegations saying that the manufacturer have closed now, and that, I mean, these are allegations, and we are not really aware of that. We are doing due diligence. Sorry, we are investigating. The investigations are ongoing for all to make sure that at the last level, everything is actually clear for everybody, and then the right actions will be taken. Investigations will be done, and when investigations are done, it will be definitely sent to the competent authority to take their course of action. So I mean, I think that is what I have to say.
We just have the director of health promotion join us now, because you guys also work with the Ministry of Health, right? Because it's all the same. What does the Ministry of Health provide for the agency? Is it supervisory role? What exactly what kind of collaboration do you have with the Ministry of Health, Markieu?
Of course, the Ministry of Health is the line ministry. This is an agency, it's a government agency, and the Ministry of Health, as you can rightly understand, is the minister, is the head of the agency, being a government agency, and that's the line ministry. And yes, we do all collaboration, and it is the government of the Gambia that is subventing this institution. They are giving subvention to this institution for the enrollment of the staff, and also for what the activities that are being implemented. of course, we have, as I said,
Njai, we are hearing a lot of noise from your end, Njai.
Sorry, there's
No, I don't know.
I'm sorry.
Some
interruption with my line.
Your line.
I can't hear you anymore. Can you hear me? I can't hear you anymore.
You have to
I think when a line
comment.
comes in, I can no longer hear you.
So
I can't hear you anymore.
Yes, you have to go back and come in then, Markieu.
I can't hear you.
You have to go back and come in. You have to go back and come in. You have to leave.
I can't hear you.
You have to leave and
I am hearing both Fatou and Markieu.
Yes, Markieu is gone. She's gonna. So Modou,
yes.
Welcome to the show.
Thank you very much, Fatou. And thank you for inviting me.
Now, Modou, this is a very serious issue. 60 babies in developed countries. If a single baby dies out of this, some people will say this is negligence. We will be hearing resignations or people being sacked right now. At this point, 66 babies have already died due to this issue. What is the ministry doing? Now, before I got you to come into the show, I was talking to some people at the ministry, senior officials, and I'm being told right now they have been summoned at the State House, and there will be a press release later on. Can you confirm this to me? Is there any consultations or meetings going on right now as to what is happening?
Thank you very much, Fatou. To be honest with you, I'm not aware of any meeting because my office is in Kotu, and then today, since in the morning, I was also involved in a meeting at the regional office in Kanifing. That's the Regional Health Directorate in Kanifing, and I'm just coming from there. Then I just saw your email, your message that you wanted to have an interview with me. Then that is why I have to rush from that meeting to come on, because that's where I left all my gadgets here. So basically, I'm not aware of that meeting, but I'll find out. I'm sure if I'll make consultation to find out. If there is any, then I'll give you the feedback of that meeting if I have the information.
No. Let's talk about this incident. The Ministry of Health issued a statement about a month or so talking about some medication that they have withdrawn. Now, I just had Markieu. Markieu is the executive director of the Medical Control Agency. They supervise medications that come in, but the overall the responsibility is the ministry. This agency is under the Ministry of Health. Now, how did this happen? What were the, she talked about lack of capacity to be able to monitor every medication that comes into the country. But now, how can we trust that anything that we are consuming right now, it is good for our families?
It may not be the case, Fatou. Basically, as you know, medicines, really, they're supposed to go through some quality tests, and also some, it has to go through laboratory tests and so on. And I'm so, and we know also the capacity in those areas in terms of equipment, in terms of laboratory equipment, and as well as the human resource capacity. So perhaps that is where she's talking from, and I think that could also be the case whereby you don't have the right personnel. For example, if they may be there, few of them may have the qualification in the area, but perhaps there are not many. And then considering that the population is also increasing in this country, and we are having more and more facilities, and also we are also having more and more drugs entering into the country because the population is also growing, and the demand for certain drugs are also high on this. So therefore, what she mentioned, actually, I want to agree with her on that area. But what the ministry is doing since they start in I would say, to be specific, around July, the ministry was able to come up with a team, and they constituted a technical team that meets on a daily basis. And the technical team comprised of the MRC Gambia, the Minister of Health, also having the surveillance team, the communication team, the laboratory team, and they also WHO and UNICEF are also part of that team. So as we discuss on technical matters, and then these are the team that meets on a daily basis and weekly also, or sometimes in every week, like there'll be 2 meetings where the minister will attend, and then he'll be briefed on that, and we also make some certain conclusions or certain discussions around that. So we have also, during this meeting, some of the issues will come up, and then the technical team will also be able to come up with technical information and also technical guidance and support. So when we realized that the cases were on the increase, we had to strengthen our surveillance system. So, in fact, the ministry was also able to make sure that at least one, we were able to come up with key messages. The ministry was, with the support of the stakeholders, we were able to come up with key messages. And the key messages, one, we have messages addressing, focusing on families and caregivers, and that's for the general population. And we also have messages for the healthcare workers. So this was widely circulated. And then also there was followed by a letter and to inform our officers in charge or some of our staff responsible for health facilities, for them to be aware of the use of, cough syrups, like, for example, paracetamol and other syrups. That was the beginning. And then until such a time, the investigations were ongoing, because we didn't come up with any conclusion at the time. And then until such a time, the 23 samples were taken for certain investigation, and there was suspicion of certain chemical involvement into that.
But Dr. Njai, that is serious concern. Now, it has to take for somebody to get sick. It took for some people to die before the ministry could even establish what was wrong. Now, what happens in between the time these medications came until they were consumed? What were the mechanisms that were used by the ministry, by the agency, to be able to determine if these medications are okay? Now, this is, I think the problem started when the medications came. What were used, what kind of methods were used to make sure these medications that are brought into the country are good for consumption, Modou?
Okay, Fatou, I think you are right. I think what I'm saying is, like, when it comes to quality tests, for example, and the MCA is the mandate, they have the mandate to be able to ensure that all these medicine go to quality tests and before they are consumed and before they are passed to get into the country. So that perhaps Markieu would have dealt with that. But when it comes to
Markieu did deal with that, but she said, yes, they are doing that, but they don't have the capacity to do everything. Now that is the problem. Well,
perhaps one may not know exactly where these drugs came from. Perhaps that could be another information. That is why we also sent our teams. And then, as I said, the surveillance officers were on the ground. They're not only looking at the cause of the illness and also looking at the situation in the household, but they also look at some of the areas where some of these drugs were also purchased from. And then, as they are also moving, perhaps when all the analysis are done, we should be able to know actually why was this, what are some of the challenges, and what were some of the issues with regards to this medication. So perhaps when it comes to medication, Markieu will be able to deal with that. But I was also trying to explain the structures that have been put in place to ensure that there is rigorous monitoring, and then also there is also supervision. And I'm sure the Central Medical Store, the National Pharmaceutical Services, is working very closely with the Medicine Control Agency in terms of monitoring, in terms of supervision. So perhaps, as Markieu rightly mentioned, there could be some gaps in terms of capacity. And I think this is something that I also want to agree with her. But when it comes to the fact that we didn't wait to see that people are dying, the ministry never wanted any child to die. That is not the intention of the Minister of Health, to wait for any child to die. But we know that when any child that dies, there were some follow-ups, there were some investigations to find out the cause of death. And that led to all this investigation, that led to all this sample collection, that led to all this tightening of the surveillance. So meaning the ministry is very concerned, and that's why they were able to come up with almost all these measures in terms of constituting a team whereby the team should be able to, there's a technical team that meets, as I said, on a daily basis, and they also provide feedback information to the general body on like every Friday, every end of week, or sometimes twice in a week. And those decisions that are taken there are the ones that I've been implementing. And I think one of the decisions that came from that meeting, some of that meeting, is that we need to communicate to the public. And that is why since then, we have been communicating to the public to raise awareness and to ensure that each and everyone, like every household head or a family head or a caregiver, if you see a child that has some of the symptoms, like we talked about vomiting, we talked about diarrhea, we talked about difficulty in passing urine, so we always advise them to visit the health facility immediately. And that was our message. And that was why, that was why we even had many people now reporting to the health facilities on time, because they have been informed that if you are able to see any of the signs that we have been talking about, they should refer immediately. They shouldn't wait for any delay, or they shouldn't delay in terms of taking that particular child to the health facility. And that also helped. That also helped a lot because our health workers, when they go, when these families are. No, wait, I'm coming, Fatou. Wait, I'm coming. I'm coming.
Let me just interject here.
Yes, okay. Go ahead.
How rigorous is this campaign to get to households? Now, don't just sit there, like a press release is not enough. Because like Markieu said before she left, these medications have been bought by family people, right? They have it in their cupboards. They have it because you buy a small paracetamol box, you keep it for 1 year because, you cannot consume it all syrup for one time. Now, people have this in their homes. Now, you guys issued a statement. I am in the media. I have not seen any serious campaign as to telling people to stop using this medication or dispose them of or whatever. I haven't seen that. Now, people are still using this. Now, I'm sure we are going to see more deaths because a lot of the people, the folks, especially in the up countries, maybe they don't even know about this. What is the ministry doing? This is a very, very serious issue. What is the ministry and the agency doing right now to make sure that no Gambian or nobody in that country is consuming this medication right now?
As I tell you, the recall exercise is ongoing. And then prior to the recall exercise, there was also a message. Perhaps you missed that. In fact, I saw your communication because when we posted that on our Facebook page, I think I saw you the connection between the Kerr Fatou and also that of the Minister of Health Facebook page. So really, I'm very sure that you are aware, and then your organization, your media house is aware.
I'm saying. I'm coming. Apart from a press release.
I'm coming. Okay, I'm coming.
Okay.
Now, what I'm also saying is that Markieu herself. And then the whole of last 2 weeks, there have been some rigorous media engagement and media sensitization, using all available communication channels. And as I speak to you, maybe perhaps you are not currently in country, but what happened in the regional? I was able to communicate to the regions. In each region, we have a regional health promotion and education officer. So what we ask them to do is to be able to mobilize all available free airtime that they can be able to use, including our clinics, including other areas that they can be able to meet people, especially women and children, women, men, wherever they can meet them, especially in outstate clinics which happens every day or sometimes every week in certain communities, or sometimes once in every month in every community in certain communities. So we ask them to use those available channels of communication to communicate to the public. And this is currently ongoing. And that is why when the teams went out for the recall exercise, that was a big, there was a total cooperation of the general public. People were even volunteering to take out the medicines and give it to the teams. And this is something that we got from the communities, and I think we really appreciated those because they had already been well informed in advance. And then prior to the arrival of the teams, they were able to get this medication at their, be it in the cells or be it wherever they keep it, they were able to voluntarily hand it over to the teams that are collecting the medicines across the whole country. This exercise is currently ongoing across the whole country. So this is why I'm saying the ministry is doing something about it.
Now, Markieu, a lot of people raise concerns of the regulators themselves being involved in the business. Now, if the regulators who are supposed to regulate the people in the business are also themselves engaged in the business, there comes conflict of interest. Who regulate the regulators themselves? Now, the pharmacy business, the medicine business is a very lucrative business in the Gambia. Is this true that some regulators are involved in bringing medications themselves into the country?
Yes, as you are alluding to, but you're interested to know that whoever is actually probably importing this is not actually a regulator. So this is, it is sometimes a perception. Conflict of interest does arise, but we are very mindful of it at the Medicines Control Agency, and full disclosure is done. It's not a hidden thing. It's not hidden at all. So it is common knowledge that some regulators are also engaged in the private business. But as I said, we have policies, we have guidelines, and we have instruments to make sure that people have full disclosure. They sign declaration of conflict of interest agreements, confidentiality agreements, And, we do make sure that whoever is engaged in a particular business does not actually involve in any activity of the, whoever you are engaged in. These are tools that we have actually put in place to manage this issue of conflict of interest. There are challenges, of course, and it may not be the ideal solution, but we are working towards, how best to at least address the issue and make it, the person to be, in people's mind to think. People are thinking, oh, because they're working here and there. It's not all staff of the agency, as I said, and the ones that are involved. Disclosure, and we try to manage it by saying these regulatory activities, whether it's inspection, whether it's regulation, you cannot be involved if you are covering or supervising that pharmacy. So at least that makes it, independent. Someone else will do the inspection, someone else will do the evaluation, and et cetera, et cetera. And then, of course, all decisions will go to the, to the right channel, to the head of the agency, and then the right measures and the right decisions will be taken. But as I said, again, it is it is a reality, and all countries of the world, all regulatory agencies, or all sort of, how can I say? I mean, stakeholders. I mean, these are realities, but the issue is how do you manage it? You have to make sure you have principles, you have policies, you have guidelines, and you fully enforce it to try and manage the situation. Of course, Gambia being a small country, a small size, limited human resources, I think that is some of the challenges that we face that may have resulted to this. But as I said, it is something that we're working towards, but this is the reality.
Now, what happens to this particular person?
I'm not having much charge, so you may have to.
I'm just going to do quickly. Now, you said you guys are doing investigations are on, but what temporary measures are taking right now when it comes to this particular the person who imported these particular products that have been recalled? What is going on right now when it comes to those suppliers, the people that brought in these medications?
Suppliers, all products being imported that are related to these things, all the products have been recalled. They have been put on quarantine while investigations are ongoing. So, you cannot import any of this anymore. You cannot use it anymore until the investigations are conclusive. Once they're conclusive, of course, we will send it to the legal authority, to the right competent authority to have the legal opinion, and then they can proceed when it comes to legal issues. But we are, at the moment, our foremost interest is to try and make sure that we get these medicines, from the shelves, from the people, not to use it, so that not to cause further harm.
But is there any suspension of their license or anything? Because we're talking about 66 babies killed right now because of this.
But as you know, there are legal actions, there are legal opinions. And I said, if an investigation is ongoing, I mean, there is a legal course of action, and then we are being advised appropriately by the, the legal. But unfortunately, legal issues do have a process. You cannot just jump when an investigation is ongoing to say you can do X, Y, and Z. But be assured that we are doing all we can. We're collaborating with the right and competent authorities to make sure whatever should be done is done.
Now, before you leave, I know you told me, in fact, we were supposed to have you for 10 minutes. I'm sorry for taking your time. You have another interview. And I want to say this. I called you. I know, it's already 40 minutes because I was just supposed to have you for 10 minutes because you have another engagement. Sorry about that. Now, before you leave, a lot of Gambians, including myself, are worried right now to take any medication. I spoke to a woman this morning, and she said all of her kids are sick with herself, and all of her kids are sick right now. She doesn't want to take any medication. How safe are those medications that are on the shelves right now? The Gambian people want to be assured of that.
Yes, I mean, that is a very natural phenomenon. I would feel the same. But as unfortunate as the circumstances, we've never had this incident. People have been taking medications and this has not been happening. God forbid that it would never happen again. But what it is, if your child is sick, just to prevent now, as I said, it is a temporary measure. We don't want mothers to take what has not been assured. So we just tell them, go to a health facility. They have the medications, or they will tell you what to use. There are alternatives to some of these affected medicines. I mean, people are saying they never should use paracetamol again, but that is not the issue. Paracetamol, there are other different formulations, what we call suppositories. If you're a child, you cannot take a syrup, you can use suppositories. There are some sort of like injections available. There are also sort of like tablets, but then we don't want to blindly tell people that take adult paracetamol tablets because you may not know the dosage. But if you go to the health facility, they will tell you, for example, your child is sick, you need to take something to reduce the fever. This is the amount of paracetamol. Either the child, the adult, what we call pediatric paracetamol tablets, which they will tell you what the right dose is. If that is not available, you can even use the adult paracetamol, but then you have to break it to the right dosage, dissolve it, and give it to your child. It is not the most appropriate, but it is a temporary measure. As you are aware, I mean, when we were all children, maybe most of these syrups weren't available. We're using tablets that are broken, and then you disperse and give it. So we are trying to assure the public that this is a temporary measure, and we're just trying to protect the children. I mean, this is not occurring in adults, and we are doing all we can. After this recall from medicines, we're doing what we call a general risk-based survey, where we're receiving support, and we're going to sample more medications to see the level of the quality or any other factors, just to make sure that we restore confidence. But this is a natural phenomenon. I mean, if something like this happens, of course, everyone needs to be aware. But be rest assured that medications are out there, they are safe, they are of good quality. If you are in doubt or your child is sick, please take them to the health facility, and the health workers would know what to do. So it's just, this category that we are saying that we should get everybody to avoid the usage until we have the appropriate clearance from the Medicines Control Agency. And it is not an easy period, but we really would like the full cooperation of the public on that matter.
Thank you very much, Mikey. We will keep contacting you for more updates as to what the investigation, because what we know in Gambia, people will always tell you there are investigations coming on and never get results, but this is between life and death issues. We hope that the investigations come out very quickly and the public is updated to as to what really happened. So thank you very much, and we'll definitely,
All just due fairness, I think investigations have been ongoing, and this is why we have been doing these actions to make sure. And it's just that we cannot take action now until it's conclusive. But definitely investigations are ongoing, and we are taking this very, very seriously. It is a serious issue, and we're taking it very seriously. So the public will be rightly informed at the appropriate time.
All right. Thank you very much, Mikey. Thank you for your time.
Modou, I say greetings to you, and I'm leaving.
Oh, thank you, Markieu. Thank you, Markieu. Thank you. I think really you have really hit on the points. Basically, with regards to for example, she asked about withdrawing the lancing, and as you rightly mentioned, since the investigation is already ongoing, and when the results of the investigations are known, then perhaps that's the time one can take the necessary legal actions against the importers. So I think that was really a point that has, and also the fact that people should not be scared.
But Modou, you don't think that at least there should be a suspension of license?
Right now, no, that'll be suspension. That'll be suspension. That one, when the investigations are done, then that's the time you get the facts, and that's the time you can act. So now what we can do is to suspend the use of the product, and I think we are also working. We are not only in the Greater Banjul area, as I already mentioned. The teams are across the whole country, and now even the committee members are now volunteering to hand over any of those items that they have in their household. So which is a great move for now. But also taking the drugs away and also ensuring that the drugs are kept. This meant like paracetamol. And then for me, people should not have the feeling that they should not go to
Markieu, I think Markieu has another engagement. Markieu,
no, perhaps Markieu can still listen. People cannot say that, well, I'm not going to help facilitate. Please let them trust.
I have to leave. unfortunately,
no, it's fine. It's fine. Let them trust our health facilities. So any family that has a sick child, and please let them kindly rush to the health facility on time, because what we are trying to avoid is a delay in care. So the moment there is this early visit to the health facility, then that will also give the chance to the surveillance team, because now, as I speak to you now, all the health facility staff, all the health facilities, we are also being able to reactivate the surveillance activities. So what we are now doing, the desk officers who are doing surveillance are now working very closely with the clinicians, so that any other case they see, then the surveillance team will now pick that one up and also go and do the surveillance investigation from the household down to the health facility. And I think this is something that we want to encourage. At the moment, the family members are really cooperating in this area.
The ministry has to do a lot of work to earn the trust of the Gambians. Now, this is the number 66 babies that we're even quoting here. We don't know how accurate that number is, because that is just what you guys are able to collect on your data. Now, what about those kids that have been killed in the provinces, in the villages, and they have not visited the hospitals? And this is all because of some of these medications they have used. Maybe more kids are going to die out of it, and Gambians are worried. Now, this is not, if this is in any country. No, let me finish.
Can I just kindly clear that one? Can I kindly clear that area, please?
No, let me finish this.
Okay,
if
go ahead.
This happens in any major country, in any serious country, let me say that, right? By now, those suppliers, their license would be put on suspension. Those regulatory measures should be there. If people default or they have issues, you put suspension on their license. That doesn't mean you're taking their license, but you're suspending them for what has happened. Now, this is not 1 or 2 babies. This is 66 and more babies that have been killed. If you're telling me you're going to wait until those investigations are over, then there's serious concerns about that. And number 2, I have said this and I'm going to keep saying it. I have not seen any major campaign where the ministry is going door to door doing sensitization. If not for the WHO alert that really came this big, we would not be talking about this. Yes, the press release was issued 1 or twice. That was it, Modou. Let's be honest here. That was it.
Okay. Now, let me make clarification. Perhaps you are not following, but we have a caravan that has been going around Banjul, KMC, and Serekunda, and this is for this area. But let me also inform you. I mean, you can ask anybody in the provinces. We have intensified communication at all the levels. And then you're also talking about the communication we have also started using our radios, our community radio stations, and the private radio stations, as I already mentioned earlier on. And these have already been utilized. The airtimes have already been utilized. And every clinic that is happening in the country, we know that there are a large number of people who come back to those clinics. So the health workers are using that also as an avenue to talk to the mothers so that the messages can be widely spread. That is already ongoing for the past 2 to 3 weeks. And also, you have also mentioned that perhaps your other concern that you raised is about maybe those people who are dying in the villages. I want to inform you that we are working closely with our health facilities in the peripheral health facilities, and also the district hospitals, and as well as the general hospitals across the whole country. We are using the primary healthcare approach, whereby if somebody is sick in the village and then they are taken to the key village, and the key village or a health post or a community clinic, somebody is already there who will also do the assessment, and the person will also refer to the next level, that is a health facility, maybe it could be minor health center, and also to the major health center, then to a district hospital, followed by a general hospital. So most of the cases we are talking about, some of them are coming from the villages, and then these are cases that come from the villages and then refer to the next level. And then because we are now telling them, if you don't understand anything in your child and they were able to detect some of these signs that we have been mentioning to them, kindly refer immediately. And as a result of that, these referrals were also being recorded. So remember that the EFSTH is the main referral hospital. So obviously, all other health facilities across will be able to refer to following the appropriate channels. Knowing that, for example, Basse cannot directly refer from Basse to Banjul. they have to refer to Bansang, and Bansang will do the assessment, and Bansang also refers to Banjul. That is our referral protocol, because we have developed a protocol for referral. So this is what I also want to make clear for you to understand, that something is happening. The ministry is not folding its hands to say that let's watch the situation. As we are working towards our the approach, like for example, the ministry set up certain technical teams, and also we're also strengthening surveillance. I mentioned this all along, and the surveillance teams are also working very closely with the clinicians in every health facility in this country. So that is how we are able to detect some of these cases as we are moving on our surveillance. So I think this is something that I want to make clear at this point in time. Thank you.
Now, why did it take this long for us to have this major alert? Why did it have to come from the WHO? I want to make it very clear. When our samples were collected, 23 samples were collected, and then they were taken to WHO, obviously WHO reference lab. So the information is not being reported by the WHO. Instead, it is the Minister of Health, because we are the one giving them the information. So it's not only WHO that is working in this area. It is the Minister of Health, WHO, MRC, and as well as also UNICEF. So it's a joint intervention. So when these samples were taken, and then it is WHO, obviously, they are the technical specialized agency for health within the UN system. So obviously, as a technically specialized agency, automatically the information will have to come from them. But really, we are in this together. It doesn't mean that the ministry is not aware of what is going on. They sit in the committee. Sometimes when the meetings happen, it is WHO country representative that will chair the sessions. So automatically we are in this together. It doesn't mean that the information just come from WHO, like the ministry is not aware. No, we are all into this together. Thank you. Now, 66 babies have died. What is going to be the consequences? I mean, the blame should not just be on the supplier. The ministry should take some blame, because they are responsible. As far as we know, some people will even tell you they don't know about the medicine board. What they know, that we have a Ministry of Health that is supposed to make sure everything that we consume is safe to consume. Everything that we take as medication should be safe. What happens now? What happens? What do we expect? Are we going to see heads rolling?
Well, I'm not in the policy making decision level. But what I can say is that the ministry is also doing its best to make sure that at least we address this situation. And how do we address it? One, I mentioned it, we're trying to strengthen our various areas in terms of operation. I said it at the beginning that case management has been strengthened, surveillance has been strengthened, because these two are very key. And we're also strengthening communication interventions across the whole country. And the recall exercise is purely multi-sectoral in nature, and all the stakeholders are really participating, including the committee members themselves. So this is something that I can say is really happening, but no ministry and no individual would like to see children who are the future leaders of tomorrow to die like that without taking any action on that. So for that area, I will not be able to tell you that something will happen. But as far as I'm concerned, at the level of the ministry, we are doing what we can do, and at this level, to make that we strengthen laboratory, we strengthen surveillance, we strengthen the case management, so that at least as the cases are coming from the committees, we are also able to address them. And interestingly, those who are able to refer the children on time, and then we are able to detect some of those signs in them, like for example, fever, vomiting at the time, they were also able to refer on time. And some of them also started seeing some signs like swollen limbs and so on. And when that happened, immediately they refer. And that was a very good move.
Are we seeing more of these symptoms still at the hospital? Are we seeing them coming in still?
As far as I know, I will not be able to give you the exact statistics as to where we are right now, because we haven't got still. We are supposed to have the situation report. The situation report today. Whenever I have it, perhaps I can be able to send it to your page, but I will not be able to tell you how many children are there. But as I speak to you, hence we are trying to trigger, and we are trying to engage the communities to sensitize them on the referral protocols. Really, a lot of referrals are already ongoing now. Like anybody who see a child that is sick now, even they're not even looking at the case definition. but they're also looking at any child that has fever, they immediately refer. And I thought that's a very good approach for now. And that is also going to help our clinicians to be able to identify what type of sickness are they dealing with in their health facilities.
So do you think there will be more deaths related to this medication? Because like you said, you are doing the recall, right? And you people are still getting, some of these households having these medications at home, and some of them are using it. Are we expecting more conditions of this nature at the hospitals?
I may not say it's possible, because we are in a situation where I cannot just say we don't expect it or we might not expect it. But what we are now doing is to ensure that anything that has to do with the medicine and any sickness, for example, the sickness, if it has to do with the medicine, that's why we are doing the recall, and I think the recall exercise is ongoing. We are not stopping the recall exercise. That is one thing. We are moving until such a time that we are able to get, in fact, to a level whereby people will even volunteer and come. Because as what we are seeing, the trend we are seeing now, people are now volunteering to come forward to bring the medication. So this, for now, we might also see some cases that are similar to Aki, but it's possible. But as far as I know, since we are strengthening surveillance, it's really helping us a lot now at this point in time.
Now, Modou, when are we going to see the ministry officially address the country? This is a serious case. This is a serious issue. The Minister of Health, Dr. Samaté, should be addressing the nation as we speak. Now, this alert came since in the morning. I don't know whether yesterday or this morning. It's over 7 hours or so. We haven't had anything from the ministry. You are the Director of Health Promotion. When is the minister going to address the nation? People want to get assurance. We want to hear from the minister. When is Dr. Samaté going to address the nation?
I am not sure exactly when, but tomorrow is proposed for us to meet, and most likely when we meet on that one tomorrow morning, I should be able to give you an update on that. But he was very much willing, and in fact, his statement has already been prepared, and for him to also get to the public and communicate to the public. I am very sure it's going to be done, and I'm not going to tell you, I'm not going to specify to say when tomorrow, but tomorrow most likely he will be able to come out and talk to the public. We are also in touch with that.
Why does it have to take till tomorrow, Modou?
I'm just saying it could be done. I'm here today, but the statement is already done, and then most likely, because we have to engage the media. And I soon know, Fatou, when we are doing this type of statement, we have to invite the media. And the complaints we are having from them at some point is that sometimes it is too late, or we cannot come now, we are that and that. So, your people are always complaining to you about that. So we are very mindful of the timing. So that's why most likely tomorrow morning, something will come out. And I'm sure your people are always with us. And then sometimes when we call your people at all times, the complaints are always coming to us and say, this is not
the media is always
not a
ready,
good time.
especially when it comes to emergencies.
I know, but
the media is always
but sometimes Fatou, that's not the case sometimes. Let's be very honest.
Most of the time, most of the times we come. All the time.
Anyway,
all the
okay.
times.
I know you. We always have your cooperation. That one I know. But I'm not talking about you specifically. But sometimes that's the challenge we have. But as I speak to you, the team has been working tirelessly to make sure that at least a statement is prepared, and that has already been done. And now, inshallah, the minister will come and talk to the public. Thank you.
Now that these. I know I should have asked Markieu this, but I'll bring it to you now.
Fatou, but you are taking my time. Right now, I think we are supposed to speak not more than 20 minutes.
Two questions.
But you're really taking part of my time. And
all right,
okay. Okay, no problem.
So you're giving me so much headache, though, doctor. I just even understand. I'm calling you doctor now. It's just, I guess it's the same question that I asked before that I'm going to ask again. How safe are our medications? I'm just worried. How safe are the medications? What assurance are you going to give the Gambians that everything that they are consuming is safe to consume at this point? Basically, that is it. And your final message to the Gambian people.
Actually, as we are doing the recall exercise, we have identified the medicine, promethazine, and also some syrups like paracetamol and so on, where for now, people should not use them. For their own safety of their families and their children, The medicines we have specified, people should not consume them for now. Other medicines, we are also avoiding self-medication. People should ensure that they should move away from self-medication. So now anyone who is sick, the only thing you need to do is to visit the nearest health facility. And the beauty of it is nobody should consider I will walk more than 5 kilometers without seeing a health facility. Anytime you walk, even less than 1 kilometer, you'll find access to a health facility. So anyone who is sick, the excuse should not be the health facility is far away from me, because anywhere you go, you see a health facility. So kindly walk to the health facility, or if it is a child, kindly refer this particular child to the nearest health facility, so that the medicine that should be given to the child or that particular sick person will be determined by the health worker on the ground. That is the advice I want to make for now. But as of now, people should not have the feeling that the medicines we have in our health facilities are not safe. No, that's not the case. We are talking about specific medicine.
The reason, let me come here. The reason why people go to pharmacies to buy medication is because there are no medications in the hospitals. You go to the hospital, let me finish. You go to the hospital, the doctors give you medication and they tell you go buy it at the pharmacy. Now, if we don't have medication at the hospitals, we go buy them at the pharmacies. You cannot sit here and tell me there are medications at the hospitals. 80% there are no medications. They give you 5 medications, only 1 or 2 is available at the hospital, Modou. That is the reality. That is the fact.
Yeah, I know it happens that whereby sometimes it happens that sometimes you go to the facility, and then after prescription you are given 1 or 2 items and the remaining you have to look for them. So these are the real situations. I will not disagree with you on that. But what I'm now saying is, like, for example, the beauty of the whole thing, even whether the medicines is not available at the time, but you should be able to get a qualified person to be able to do the prescription for you. And the prescription will now guide you as to what you should take and what you should not take. That's what I'm focusing on. And then at some point also you go to health facilities, you get all your requirements. All what you are supposed to get, you get them. And sometimes you go, and as you know, the suppliers may exhaust at the time. Like, for example, you go to health facility in the evening, and perhaps the people who are more in the morning shift, they're able to collect their supplies, and then the suppliers got exhausted. For example, if it is for the whole day, the person who comes for the afternoon shift, by the time they replenish their supplies, maybe the patient comes in, and at that time, for example, it could be there could be a gap of maybe 1 hour, 2 hours, and then before they do, I'm just giving an example. So, and then if that happens, the person goes home without medication. Really, the person will say, I went to the health facility without any medication. That is something that we are discouraging, and that's why we are now saying we should be able, that's why there was recently a training on the logistic management information system, which has been done, and training was done for almost all categories of health workers, and that was a very good thing, so that at least they should be able to know when to replenish and also when to request for medication. I think that's something that will help us a lot. And then as I speak to you now, you can sit in the central medical stores and be able to know what happens in Basse District Hospital in terms of supplies, because of the logistic management information. And we are trying to improve on that system. And I think recently it has been launched, and you can see that now you can be able to monitor as you sit in one place. For example, at the regional level, in CRR, for example, you can sit at the regional store and we'll be able to monitor the drug availability in all the health facilities in Central River region, both north and south. So this is something that we are improving on the system. But I think the people probably have to bear with us. At some point, you have ample supplies. At some point, you also have reduced supplies, and that also results to people going to health facility without getting the medical. But somebody also cannot also stand and say, I went there, I was not given anything. That doesn't happen. At least one or two you may miss, but sometimes, most of the time, you have. We have some. We know healthcare operations are very, very expensive sometimes.
Modou,
so
I don't want to argue with you, because I personally I don't like going to private hospitals because of experience with my family some time ago. So I only go to the RVH. I take my grandmother there. I take sometimes myself. I go there, and I can tell you this, Modou, most of the time she comes home, the medication list, only 1 or 2 is available out of 8. So most of the time there is no medication there. They'll give you the list of medication up to 8 or 10. You get only 1 or 2. The rest you have to buy from pharmacies. That is common knowledge, and I'm sure a lot of all the people that are watching will bear with me this particular thing that I'm saying. That is common, and I do understand that maybe government cannot do all of that. Maybe that is why going forward, there should be measures in place, strict measures in place as to who brings medication. Now, if government is the one bringing all of these medications, maybe this would not have happened, right? Because we have other people who have to complement government to bring in medications into the country. Now, some of these issues will happen. Now, the measures that government should take place to make sure anything that comes into country, it is properly checked, it is things are taken care of to make sure it's fit for consumption. That is something. Going forward, do you think those measures should be stricter now? And I think the biggest concern that everybody has in the health sector, especially in the pharmacies or even at medical board, you have doctors who work at the hospital. Now, they work at the hospital, they have their own private pharmacies, and they make sure that all the medications are available at their pharmacies, but it's not at a hospital. I don't know how that happens, number one. But number two, also, you have people who are in the system. There are a limited number of people who have these licenses for pharmacies. But you go to some of these pharmacies, the licenses are leased or rented to these people. That is something that you guys cannot deny, because if investigations are done, that will be proven to be true. People leasing their license or renting their license to other operators, when they themselves are not the ones operating those licenses. Now, who is accountable for all of those things? These are loose angles that is happening in the ministry, and there's no control. That is the fact, Modou. What is the ministry going to do to make sure now these stringent measures are put in place? 66 people killed. In other countries, this will be a state of emergency.
Fatou, you're right. But when you talk about measures, we have two main bodies responsible. We have the Pharmacy Council and we have the Medicine Control Agency. And the Medicine Control Agency, one of their mandate is to regulate. And I think as regulators, basically their role is to monitor and supervise the drugs that are coming into the country, and also its usage, and also to see the safety of those, the drugs that we are also consuming. So really, as Markieu rightly mentioned, we also need to strengthen the capacity of the laboratory so that the drugs can be tested upon arrival, and then so that when testings are done, the analysis can be done, and also that can provide some answers. And we also need to build capacity in terms of human resource capacity, and that will also help in terms of operating the labs. And also, so Markieu really mentioned about those some of those challenges. Perhaps what needs to be done is to strengthen that. So we also need to strengthen the inspections. That we, as you know, they have an inspectorate at the Pharmacy Council. So they are also ensuring that anyone who's going to be registered, they are also regulated. So that's also something that will be strengthened. But we're talking about people leasing their lances. Perhaps I may not have more idea on that, but perhaps the executive director of Pharmacy and Medicine Control Agency will be able to throw light on that. But I know some people will say, well, my lancing is, I got a lancing, rented lancing from someone. But this is somebody who has disqualified to have the lancing and was also able to get the lancing and hired to somebody else. So perhaps those details, the executive director will be able to throw light on that, perhaps in the subsequent meetings. But what I want to emphasize here is, even whereas we are given the license to operate, you should also be able to observe the rules that guiding the operations of that particular pharmacy. So these are some of the, that's why the Pharmacy Council and also plus the Medicine Control Agency and also the Minister of Health are working very closely in terms of ensuring that people sell the right medicines in the right places. So there are some gaps here and there which we need to improve on, and I think Markieu already highlighted some of those gaps. So we will improve on that and this is what this call is very appreciated, and then it's also going to tell us where we are doing right and where we are not doing right. And where we are not doing right, we need to improve on those ones. So as I speak to you at the beginning, we have been working very closely to ensure, hard to ensure that our surveillance system is strengthened, the clinical sites are also strengthened, and as well as also the laboratory. So we are going to work on and to ensure that those areas are well improved in terms of our operations.
Thank you very much, Modou. We hope to hear from your ministry very soon.
as to what the current situations are, what are the realities on the ground, and what is the ministry doing to make sure that Gambians feel safe and to make sure that the medication that we are consuming are safe and sound. Thank you very much, Modou, for your time. On a short notice, you were able to join us. Thank you very much.
This is our job. We need to come out. Anytime we are needed, we should be able to talk to the public. That's our, and also thank you for contacting me too. But no worries. Anytime you want to contact me for information, if I have that information, definitely I'll be more than willing to give you at any time. Don't be it odd hours, be it any time. I'm always available as usual. Thank you very much.
I want to say that Modou is one of those people at the ministry who is very accessible. I've been talking to one of the most senior officials at the ministry for the past since in the morning. To get them on the platform to talk to us is always difficult. So at least Modou, makes himself available to talk to us. And I think that is important. People need to hear from you guys because this is a serious issue. Mothers are worried. Fathers are worried about their kids. And the ministry should be on every channel right now talking to the people. So I'm glad that you were able to come on, you and Markieu, to talk to us about this. Thank you very much, Modou.
Thank you.
And guys, this brings us to the end of this show. Like I said, we tried to, I've been told by an official of the ministry that they're not able to come on right now because they are at State House and they should be addressing the media at 7. That's what I was told. But Modou is telling us maybe tomorrow. So hopefully we hear from the ministry. Hopefully we hear from them and see what really is happening. This is a serious issue, and like I said earlier, if this was in other countries, people will be resigning. People will be at media houses addressing the nation, talking to Gambians. There will be an outcry everywhere to get people through these medications. But it seems like our country is different. It seems like we are in a different scenario. So hopefully the ministry comes out. Hopefully the minister himself comes out to assure the general public. I think we owe this, the minister owes this to the general public to come out and speak to us. And I'm hoping that he will come out and speak to us. So thank you very much. If we have any updates from the ministry, we will come back to let you guys know. Thank you very much and good night to you all. Bye-bye.
When me touch down, better broke down.
Gamtel G-Fiber, now you can enjoy super fast internet in gigabytes. G-Fiber is affordable, stable, secured, and accessible to homes, businesses, and enterprises. With Gamtel G-Fiber, the future is speed. Gamtel, creating a brighter future in communication.
So she became mine and see the
better and stronger as the sole ground operator at the Banjul International Airport. With an expansion in travel services, customers are assured of GIA's capacity to cater for all their travel needs, provided by professional, experienced, and ever-smiling staff. GIA's Hajj package and services, by far the best in the country, give the customers the opportunity for a memorable Hajj experience. For a more efficient cargo services, GIA means business as it launches its new multi-million-dollar ultra-modern cargo complex to revitalize and stimulate air transport. GIA, the pride of the Gambia.
Every day is a new opportunity to make sure our first impressions are always our best and to see possibilities on the horizon. To make our facilities and services more accessible and find freedom all around us, with a location proximity to active markets, with a liberal air transportation policy. That daily pursuit is how we turn everyday opportunities for you. For all destination marketing support, customized packages for new existing airlines and operators, and for a highly ranked tourist destination, the Gambia Civil Aviation Authority is here to serve. We regulate air transport, operate and manage BIA technical requirements merged with commercial considerations. We have experienced and well-trained aviation professionals to cater for your needs. For investment opportunities in building airport hotels, shopping malls, playground for children, do contact us on 4472-831, 4472-893. Gambia Civil Aviation Authority. We go beyond daily.